Good morning, everybody, and welcome to the last talk of the Leading Through Change session. I'm Paul Geddes, and I'll be joined over Zoom by Norma Jean Adsick from Smithers, British Columbia. Norma Jean is our Manager of Health, Safety, and Infection Prevention. We're honored to be given the opportunity to share with the industry how Skeena managed to safely implement a very large-scale exploration and development program this last year, especially in light of the fact that we did it during a global pandemic and all the uncertainties associated with that. Our greatest accomplishment, though, was we set out a goal of zero harm, and we managed to achieve that. For those that may not be aware, we operate in the Golden Triangle of British Columbia, north of Stewart, BC. But most importantly, I want to recognize that Skeena's properties are in the Tahltan Nation territory, and the communities of Telegraph Creek and Iskut are most proximal to our project. Our relationship with Tahltan as guests in their territory and as our partners in building SK Creek is obviously an extremely high priority for the company. It's also important to note that Skeena's got a very strong desire to safeguard not only our workers and team members, but also that of our neighbors and partners. And as Bonnie Henry says, we're all in this together. Well, let's cut right to it. 2020 was a very large and successful year for Skeena Resources. Basically, we drilled 90,000 meters. We had team members, well, 250 of them spread across 6 camp facilities. And at our peak, we had up to 13 drill rigs operating. Now, that on its own in a standard year is a pretty significant achievement. However, in this year, we managed to actually top that. And we are currently sitting at greater than 500,000 COVID-free person hours. And I want to personally thank absolutely every single team member that was a part of this, because again, we're all in this together. Well, if we go back to the first quarter of 2020, corporately, we had some technical objectives that we had to meet. Again, as I just alluded to, we had to drill 90,000 meters. We had to perform geotechnical assessments for the pre-feasibility work. And largely, we had to convert all the inferred resources that are currently on the books for SK Creek to the measured and the indicated categories. Now, why was that so important? Well, because we wanted to put out a resource update in the first quarter of 2021, which would ultimately feed into a pre-feasibility study. And as we all know, we can't go into pre-feas and have reserves from inferred ounces. So that's why it was so critical to maintain that timeline. However, again, the uncertainty of trying to do this in a global pandemic and achieving the goal of nobody getting sick, well, it became difficult. There was no playbook to reach for. However, we were wise to history repeating itself. If we look at the chart for the deaths on the Spanish flu in between 1917 and 1920, we can see that there were 3 separate waves. And when we were operating and starting to put together this plan, we figured that we were just very simply in the first wave, there was going to be a long-term situation evolving from all of this. Well, the mandate was, okay, let's exceed the criteria for the current and the future guidance. We don't want anybody getting sick. We're going to throw everything we can at this. And we definitely don't want to get shut down because that's going to interrupt the timeline. We also wanted to instill confidence in the team and the community in which we operate. So we decided to start reviewing, upgrading our policies, reprogramming workflows. And essentially the idea was that we wanted to generate a sustainable framework for exploration and development and operating in this new reality that we're facing. Again, coming down to it, it turns out we were right. We not only saw the first wave, we're now currently in the second wave. Hopefully there won't be a third wave. What does all of this translate into? One singular goal. And admittedly, it was a very lofty goal of zero harm. Well, that's great. You've got a goal. You know what you have to do. How are you going to execute on that? I myself am a geologist. I know nothing about epidemiology. I do not know how to write an infection prevention control plan. Again, getting back to what we were just discussing, there was no playbook from which we could draw. So I followed a bit of advice from somebody that I worked with in the past. And his advice was that you go out and you hire somebody smarter than yourself. Go find somebody who knows what they're doing. They've been down this road and they can execute effectively. Which leads us into Norma Jean Adsick. She's our manager, health, safety, and infection prevention. Norma Jean was born in Wells, British Columbia. She knows mining like the back of her hand. She's been doing this for 35 years. And well, to be honest, she's smarter than myself. Norma Jean, at this point, I'd love to pass it off to you. And if you could please take us through all the details about how we managed to achieve 500,000 person hours COVID-free.
Thanks, Paul. I really appreciate all your support over the summer, and same with everyone else from Skeena. Thank you. So to do this, we needed to develop an infection prevention control plan, making sure that it was robust in our somewhat overcast future, incorporating PHO orders, other regulatory requirements, standards, guidance, and updates, including local health authority information and updates. This was to ensure zero transmission to our workforce, Indigenous and local communities. This addressed the task performs, the risk involved, and the mitigations. It was based on the rate of exposure, identifying hazards as low, medium, and high. Just think about where are the high touch areas surrounding you at the moment. This established protocols based on the hierarchy of controls. Our focus was to eliminate COVID-19 from entering or leaving the Skeena bubble. We needed to break the chain of transmission. We need to ensure that you were healthy prior to arrival on site. We supported 2 meters physical distancing. We installed remote hand wash stations to support frequent hand wash stations. There was engineered non-porous plastic barriers placed in transport vehicles, food service lines, and sleeping accommodations. Administratively, we provided daily updates in our safety meetings. We reviewed the protocols. We talked about the outbreaks in certain areas, signage on the floor, education and training. We also increased the cleaning and sanitizing schedules. Our PPE was as per DOT. So in the helicopters, we also incorporated gloves while in the helicopter, and worksite masks are mandatory. So we have implemented a progressive discipline program. And additionally, we do wear gloves in all of our dining and kitchen locations unless you are eating. Next slide, please, Paul. When it comes to change management, it was huge putting this all together, adjusting to all of our daily executions at all levels and planning due to our limited movements. We provided a level of confidence to ensure folks that we were doing our due diligence. We put into place the COVID COP to make sure that you're protecting yourself and others. It's not a nice title to have, but you know what? I was there to ensure everyone's health and safety. We also had to ensure mental health and well-being was being supported by reinforcing the positive with the changes. We wanted people not to be afraid to come to work. We established work pods during the rotations and transportation modes. We designated travel dates. We were consistent with our work and movements. We were promoting a healthy workplace and a healthy workforce. We had hot crew change days, moving 250 people in and out in one day. It was extremely busy, but with impeccable planning, we were able to do that. Additionally, extensive planning for visitor and arrival on site, short-term accommodation for those visitors, and additionally for repair and maintenance personnel. We also had to adjust our emergency medical calls as per OFA protocols. We were not allowed to have any contact, and only one person with appropriate PPE was able to deal with the patient. Next slide, please, Paul. We needed to develop a positive culture. So when it came to the teams, we incorporated questions in the orientations, got involvement going. We had to understand too that a lot of folks had come from home after the lockdown. They'd had no exposure to the new norm, and they were interested in the Skeena expectations and the outcomes. Everyone wanted to be healthy and stay working and be able to return home. So the shift on prevention was a very good focus. We also needed to discourage the negative non-believers in the pandemic. This was a bit of a problem with a few due to the lack of entertainment. We couldn't have common areas. There are no gym facilities allowed. So much time was spent on social media. So internet-based information became quite apparent. We had to ensure that we stayed positive, that there were no COVID-19 debates, and keep those directions going in a way where the negative will not be followed and that the positive will come forward. So once the first BC exploration outbreak was announced, it did turn heads, and as the outbreaks came closer to the north, it did become clear we were working because of our prevention policies and safe practices, and I was turning out to be not such a bad guy after all. Next slide, please, Paul. We needed to make sure that all workers were healthy prior to coming to site. So we made sure that we had a program where they could demonstrate participation in that 2-week self-monitor prior to arrival, and whether they were participating in quarantine or self-isolation, as we have workers and visitors from different various provinces and the US. So validation of the 2-week self-monitor, we developed an online app that's monitored daily for compliance, and there are also paper copies available at site. We established work pods. So basically the work pod was 14 days plus 1 day travel and or 28-day rotation and 1 day of travel. Once again, we did our hot crew change all on Wednesdays, 250 people in and 250 people out. We ensured that when you arrived at the Bob Quinn Airport that you had a work pod for vehicle transport and or heli transport to the heli locations. We also developed supports on site to ensure worker health and injury management. We had to prove that we could not be a burden on local communities or medical services to the PHO. We installed a 24/7 medical oversight with Total Medical from Smithers. We also put in a physio program with Total Physio out of Houston, and Mike is a WorkSafe BC physiotherapist. We also provided training and resources to the medics as per the physical demands analysis that were laid out, and this also provides a direct link to further medical and physio services when they are required. Next slide, please. So you can see by the map, we were widespread out for each of our camp locations, whether it be short-term, which is less than 2 weeks, or long-term, which is more than 2 weeks. We needed to have ministry approval. So we had individual trailer accommodation at 45.5 kilometer on the Eskay Road. We did have to put into service cleaning staff for the facilities and provide meal supports to prevent workers from leaving sites for supplies. Location at 58 Camp Pad, construction preparations for long-term residents, which is now complete and operational. We had a facility at Bell 2 Lodge and Skeena Trailers, which was for short-term residents. Skeena Camp on the Forest Kerr Road, long-term residents. We also had a huge work location laid down at McClymont for core logging, cutting, and shipping. That also supplies and supports SNP and the Bronson locations. We had a camp at SNP until fall long-term. We presently have a camp at Bronson, which is long-term, and the Eskay Rig Camp up on the old Eskay mine site with the construction of the new 120, presently under development, are for short and long-term. And additionally, an 8-kilometer camp on the Forest Kerr Road, which is long-term accommodation as well. So with the supply chain concerns, it resulted in ensuring that we had a 6-month supply of all PPE, COVID, and other safety-related PPE on site at all times. 16 slide, please. Then we talk about contractor engagement, participation. So we actually had to make sure that our contractors were providing COVID-19 safety plans to ensure that they were being accountable, to ensure that each job that they were doing and each task that they were performing were done safely, to ensure zero transmission to their workers. Basically, how were they going to get to site? How were they going to be transported on site? Did they come on their own? Did they participate in the Skeena charter? And ensuring that while they were traveling to the different locations on site, that they actually were an established work pod, that they were actually practicing the COVID protocols, and ensuring that there was zero transmission. So in addition, now it's 1921, It's actually 2021. And they have to update all of their information now. So they do provide sometimes their daily self-monitor as a company, and then as soon as they're on the Skeena work site, they participate in the Skeena 2-week self-monitor. We are providing daily health checks on site to all workers. We have a list of absolutely everybody on every work site, and the medics do a great job of making sure that there's no symptoms and that they're keeping track of everyone and staying on top of everyone for compliance. Along that comes, that's important, is recognition of symptoms. So if there's any questions, they do report to the medic right away, and it is established. I believe transparency for illness reporting has become very positive. We have had workers that have actually come forward and shared their illness with us, and we've taken care of that. That comes on a slide a little bit later. We'll move on to the next slide. And as far as communication, education, and awareness for the risk, we have actually applied a lot of paperwork, flow charts, requirements for pre-travel, prior to coming to site, while you're on site, and once you leave site. So we have a flow chart, and it establishes symptoms, and we've made it available to all levels. No matter what your availability to internet or computers is and/or learning capabilities, it is supported by the Skeena staff. And you know, the continual communication for risk awareness. When you're traveling, you must protect yourself. And one of the things here is, once again, the flow chart does provide a clear understanding of symptoms and transparency pre-travel. So in other words, stay at home if you're ill, or if anyone in your household has symptoms or is being tested, we can't have you on site. So basically, situational awareness. It's really important that folks are aware of the COVID situation on a daily basis, where they are in camp. And I'm finding that a lot of people feel actually safer at camp than they do at home because of the lack of worker movements. Next slide, please, Paul. COVID testing, isolation, and self-collection. So COVID testing is a controversial subject. However, we do have access to testing with our total medical oversight as per documentation requests and Zoom calls. We actually do additionally have isolation rooms, well prepared with masks, gloves, hand sanitizer, other items to keep you safe and healthy. And the other thing we need to make sure of is that we promote confidentiality. So physical checks are made by the medics 3 times a day. If for some reason you do actually develop worse symptoms, you are then assessed by the doctor. He has to order a COVID test. If that in fact actually happens, we would do a self-collection with you. We'd support you. We would then send that self-collection specimen off-site urgently to Terrace. It would be tested, and you would stay in isolation until we get a negative result and/or your symptoms reside. Additionally, what I'd like to share is that the folks that have come forward that have not been feeling well have actually stayed in isolation for a couple of days, and they actually feel much better after a couple of days of rest. And we're finding that most of the illnesses happen usually at the end of the 2-week rotation into the 3rd and 4th weeks, often due to fatigue. And one of the things I need to suggest here again is that the awareness that the PHO does not support asymptomatic testing remains in effect. Next slide, please, Paul. So we had a few close calls. The Mine Emergency Response Plan addresses COVID-19 protocols as per the Infection Prevention Control Plan. We always approach with an overabundance of caution. We also include debriefing. This identifies improvements required. As we all know, continual improvement model is in health and safety. Over this season, we had 6 suspicious workers, 5 negative results, and 1 person did not qualify for testing. As I mentioned prior, the PHO does not support asymptomatic testing. So without those symptoms, you will not be granted a test. This also allows for contact tracing for symptoms and self-isolation. If there is someone that is suspicious, we still do follow through to make sure that there is zero transmission on site, and or if people have traveled to home communities, that they are made aware of the symptoms and the requirement for self-isolation, self-monitoring. The Northern Health Medical Officer, with discussions with her, confirmed that testing of individuals is based on infectious period and of the contact and the presenting symptoms. So we're adapting to ever improving opportunities to provide service on site as the local health authority and medical facilities support based on resources. Most recently, Skeena offered to supply Mills Memorial Hospital in Terrace with an additional rapid test machine, which was awesome. However, to date, they do not have the personnel to operate those additional machines. Continual discussions with the Northern Health Medical Officer has proven that should we have a concern, our tests will be done immediately, and continual communications with her. I talked to her about all individual situations. So this is an integral part of our program. Last but not least, I would like to share that we did COVID-19 audits to ensure that Skeena was following the infection prevention control plan that they wrote, that the contractors were meeting our expectations, as were the employees. There were some deficiencies that were noted. Those were quickly changed, and we're moving forward as far as practices go. They will be continually audited moving forward. We must stay vigilant, not only at work, but in our day-to-day lives for our families and our loved ones. The greatest human kindness we can provide is to live prevention, as we've all had much time to practice.
Thanks so much, Norma Jean. Really appreciate it. Again, here we are, 500,000 person hours COVID-free, knock on wood. This was truly a team effort. And thank you to each and every individual that was a part of this, because we're all in this together. In the event that anyone has any questions or comments, please feel free to contact us, Norma Jean Adzik at normajean@skeenaresources.com, or myself, Paul Geddes, P. Geddes at skeenaresources.com. Thanks so much. Stay safe, everybody.